Thank you, Mr. Chairman, and good morning, ladies and gentlemen, and thank you for the opportunity to speak with you today. And the topic of my talk is the dynamics of an owned free-roaming dog population and some of the implications for population management. And I'd firstly just like to acknowledge my co-author on this, Dr. Anne Conan, who is not here today, but she contributed significantly to particularly the analysis of the data that I'm going to present. So as you've gleaned from the title, this presentation will explicitly focus on the management of owned dog populations, and primarily because I feel owned free-roaming dog populations, particularly in underserved communities, they face very similar challenges to community-owned or street dogs that we may be more used to dealing with in forests such as this. But I think there are significantly different factors that may regulate their populations, and I think we need to take these factors into account. And what I mean by underserved, essentially from the point of view of a lack of access to affordable veterinary care, which might include health service provision, prophylactic or therapeutic, a lack of access to reproductive control, and a lack of access to humane euthanasia for dogs. And there's a significant population of owned dogs, particularly in Africa. I think despite appearances, a number of studies, over half a dozen, have actually shown now in different areas that the majority of dogs, more than 90% in communities in Africa, are in fact owned. And as a result of that, they're actually quite amenable to quite a different method of study than we might be used to for approaching questions of population dynamics in street dogs or community-owned dogs. And that is a method known as health and demographic surveillance systems, which have been adapted from human public health and development in order to address very much the same questions that we're interested in as far as dog population dynamics go. Namely, what are the core demographic rates of these populations? What are the rates of birth? What are the rates of death and migration in these populations? And what are the factors that drive those rates? So a health and demographic surveillance system is essentially a site is a defined geographic population, so a population within what is known as a demographic surveillance area. And then essentially an HDSS operates by tracking all members of that population, in other words, all individuals resident in that DSA over a period of time. So one can define an HDSS site as a geographically defined population under continuous demographic monitoring with timely production of data on all births, deaths, migration events, and associated health indicators. And there's a very good website on the human population health and demographic surveillance systems, a network of these sites at the indepthnetwork.org. So if anybody is interested in that methodology, then that website is a very useful resource. So essentially, my team and I established a health and demographic surveillance system in dogs in South Africa. This is the area here in northeastern South Africa, very close to the Kruger National Park. That's the border of South Africa with Mozambique and with Zimbabwe to the north. And here's our site here. The bold line shows the demographic surveillance area, and the smaller polygons are all of the stands or parcels of land within that, the vast majority of which are actually residential. So the intention was to do a census of that dog population in that area, and then to follow that over time. And I'll present data from the beginning of 2012 up until mid-2014, so 30 months of data. So all of the dogs present at the time of the census and all those that entered the population during the course of the study were uniquely and permanently identified through the implantation of a microchip subcutaneously. We then we collected data with the use of smartphone apps by visiting all of those households. Approximately every 4 months on average we got around to visiting them, and essentially at each visit We just figure out which dogs are still present, what happens to the dogs that were present previously, did any dogs give birth, did any dogs die, or did any dogs migrate into or out of the household during the period between the study. And it was certainly facilitated by the fact that all of the households in the area had a unique and permanent identification number supplied by the municipality. So that in essence was the health and demographic surveillance system in dogs in that area in Bushbuck Ridge in South Africa. Just to give you a snapshot of that the area within the boundary of the DSA is about 10.4 square kilometers, although the residential stands themselves at a footprint of much smaller than that, 4.6 kilometers. During this particular round, so this just really shows a snapshot during round 6, which was late 2013. Total number of households was just over 2,000. Total number of human occupants just under 10,000. 17% of those are households own dogs. And at that particular point in time, there were 764 dogs. And you can see the densities, the 8 dogs per 100 people, etc. But of course, this is just a snapshot, and actually that population was extremely dynamic. You can see over the total period of the 30 months of the study, the population hardly changed from 800 dogs at the start to 800 dogs at the end. So there's a zero net population growth. But that masked a very substantial fluctuation in the population, with the growth rate in 2012 of a 20% annual growth rate, followed by a very dramatic decline in the population in 2013 of a negative growth rate of 22%. So a very marked fluctuation in the population and some signs of recovery towards the end of the study period. I should say that the study is ongoing, but we really only have the data for these 30 months. And those dynamics are largely driven by differences in the birth and death rate over time. So the stippled line shows the crude birth rate, which is measured in the number per 100,000 dog years. And you can see there's distinct seasonal peaks in birth. But those are almost entirely cancelled by the very high mortality rate in this population. So you can see in the period where, in the initial part of the study, where the birth rate was higher than the death rate, the population was growing. But as soon as the mortality rate crossed that birth rate, that's when we started seeing this decline in the population, and only again at that cross point did we start seeing an increase in the population. So I think the things to note with the mortality rate is in 2012 it pretty much followed the birth rate, and that's probably as a result of the very high mortality rates in puppies 0 to 3 months of age. But then we noticed an anomalous spike in mortalities in the middle of 2013, almost certainly due to a disease outbreak. Unfortunately, we don't have confirmation of that, but circumstantial evidence suggests it was a distemper outbreak that affected not only the puppies but also the adults in that population. If we look a little bit more closely at those mortality rates and just decompose them by sex, following stereotype, the females here are in pink and the males here are in blue. 2012, largely similar mortality rates between the two sexes, but in 2013, females suffered a significantly higher mortality rate than males, and I should say that's almost certainly due to natural mortality. There's not very much indication of direct human-induced mortality targeting females in preference. And that really drives, to a large extent, the sex rate. I think the majority of these populations of free-roaming dogs that we see in Africa are strongly male-biased. So this shows the number of males per 100 female. This is parity here on the x-axis. Largely constant in 2012 at about 140 males per female. But as soon as that mortality event kicked in, the sex ratio started to increase up into around 170 males per female in that particular population. So I think it just shows us that the determinants of sex ratios in these populations are highly dynamic, and probably not only driven by mortality rates. We did a pilot looking at sex ratios at birth at around about this period here in several dozen litters, and we actually found in those litters that there was a strong male bias in sex ratio at birth, actually reflecting the bias of about 1.7 male dogs for every female dog born. So I think it just shows that these determinants are quite dynamic and best addressed through these sorts of longitudinal studies. If we look at cause-specific mortality rates by sex, I should say that these are entirely owner-reported. At that stage, we weren't doing very much in establishing cause of death through necropsy examinations, but largely as a result of disease, parasites, malnutrition. The second largest category is in the larger dashed lines, actually as a result of unknown or unreported causes. Seemingly a spike in female dogs killed in late 2013, and then a small number of dogs killed through accidents, and largely reflected in the same in male rates, just at a lower proportion and perhaps slightly different timing. Male dogs killed at a slightly earlier period in that. That's not just killed by owners, that's killed by the authorities, killed by neighbors or anybody else. Did a little bit of work just to try and look at predictors of mortality rates. So these numbers show the mortality rate ratio, which compares the group in question to the baseline group. And it got a bit complicated because there's quite a complex interaction between age group and vaccination status, as well as by year, which is why I separated out the two data sets by year. But basically, if those confidence intervals cross 1, then that predictor was significantly associated with a difference in mortality rate. So, for example, females suffered a significantly higher mortality rate than males in 2013, as we saw from the graph. When it came to the interaction between age group and vaccination status, as I said, slightly more complex. I should say that when I'm talking about vaccination here, I'm talking about rabies vaccination alone. These dogs, very few of them received anything other than rabies vaccines that were supplied by the state during annual vaccination campaigns. And basically, look at the vaccinated, let's start with the unvaccinated groups in these age groups. The baseline 0 to 3 months, and then 4 to 11 months, and then greater than 12 months. Among the unvaccinated groups, the mortality rates in these age groups were significantly lower than the 0 to 3 months, essentially telling us that 0 to 3 months age groups suffer very high mortality rates, which then decrease as the dogs get older or as they move through the age groups. However, the interesting thing was actually to look at the vaccinated animals. And vaccinated animals, there's no difference in mortality rates between the age groups. And that's, we're sort of saying the same thing in a different way here, that comparing vaccinated 0 to 3 month olds to unvaccinated ones, the vaccinated ones suffered significantly lower mortality rates. And again, I emphasize this is simply vaccination due to rabies. So this is just putting that into words. It's interesting because it's almost certainly not the case that rabies was killing off these unvaccinated dogs. Even though there is rabies in the area, we probably had a sufficient herd immunity to prevent large outbreaks of rabies, and we weren't seeing a lot of rabies cases during that period, and particularly in that age group. So either it's confounded by increased levels of care of these dogs that are associated with vaccination. So for example, if an owner is going to get an animal vaccinated, that person is also going to get the dog dewormed. Maybe other vaccinations will be administered at the same time. We unfortunately don't have the data to tease that out. The other intriguing possibility is there may be a non-specific effect, protective effect of rabies vaccination in that age group, particularly in this high mortality environment. And similar things have been, similar non-specific effects of vaccines have been seen in human populations, also in these health and demographic surveillance systems. So I think that's an intriguing area of further research. We try to address the question whether or not households feel they have enough, too few, too many dogs. We did this in quarter 12, so it's not on the graph here, but it's probably at a period when the animal population was actually quite high. And surprisingly, we found that the majority of households still feel that they don't have enough dogs. So households with no dogs, non-dog owning households, almost half of them actually want at least one dog. Whereas households with one or two dogs also feel they have too few dogs. And it's only when we get into households with a larger number of dogs that they feel they have too many. So it's not a question that there are too many dogs in this population. Obviously, as we get the data on total dog numbers during that quarter, it'll be interesting to relate sort of where we are on this line with whether or not, to be able to interpret those numbers. So try to draw some sort of broad conclusions in terms of dog population management from this data. I should say that this data was collected primarily to look at the question of dog population dynamics and turnover in relation to rabies vaccination and rabies control. So we're still in the process of analyzing it more to address some of the dog population management questions. But I think these are some conclusions we can draw even in the absence of that more detailed analysis. One of those is that own dog populations in Africa are not all growing out of control. I think there's been several published studies using very different methodology which suggest that dog populations are actually growing exponentially at rates of 7 to 10%, whereas we're finding that they're actually not growing at all over the time period that we looked at. And I think some of the underlying assumptions of those studies, which really looked at retrospective owner-reported demographic rates through a single cross-sectional visit, might actually be questioned by our findings. And some of those studies rely on assumptions like a stable age and sex distribution and consistent demographic rates over time, which we have certainly found not to be the case. These populations are highly dynamic. And our findings actually reflect some other studies that apply very similar longitudinal methodologies, and this is data from Michelle Morta's studies, two populations in Johannesburg, about 500 kilometers away from our study site, also showing very constant populations over time. And that's her data from similar populations in Bali, in Indonesia. Some other conclusions. So despite this this lack of a net population growth over the course of the study, there's no question that the population is highly dynamic with very high turnover as a result of these very high birth and death rates. And this obviously has implications for welfare and for disease control in these populations. And one of the implications and one of the reasons why we did this study is because that turnover really makes maintaining herd immunity to diseases such as rabies very difficult in these populations. However, I should point out one of the main findings of the study to date, which I haven't focused on today, but it's a publication we've just submitted, is that despite these high turnovers and the high growth rates that we saw, for example, in 2012, where the population was growing by 20%, it is still possible, if we conduct vaccination campaigns that achieve vaccination coverage in 70% of the dog population in a relatively short space of time, those levels of population coverage will actually be sufficient to maintain thresholds above the critical level of herd immunity for at least 12 months. And as I say, that's even in the face of rapid population growth and high turnover. So I think that's a very encouraging message as far as rabies control is concerned. But I think that's not to say that there are not potentially significant synergies between dog population management and rabies control. And one of the questions I'm interested in now is whether or not dog population management can actually further stabilize these populations to allow us to move away from annual vaccination campaigns to possibly vaccination campaigns every 2 years. I think one of the main obstacles to sustained rabies control are things like vaccinator fatigue, donor fatigue, when people have to go out and catch these dogs year in and year out. And if we can perhaps look at moving to a 2-year cycle, I think that would greatly facilitate and make it much more sustainable. But these are questions that need to be addressed through much broader analysis, much longer term studies as well. Another conclusion that I've alluded to is that there are not always too many dogs, and almost half of the household surveys would actually like more dogs, and particularly non-owning dog households and those with only 1 or 2 dogs. And it's only when we start looking at the households with 3, 4, 5 dogs that they would actually like fewer. So dog population management is actually more of a household level thing where we need to be controlling numbers in households rather than at a population. And it's noticeable that a large number of households are actually open and available to adopting dogs. So any excess supply of dogs is immediately absorbed into the population, at least at the population levels that we were studying this population at. One of the other questions is there does seem to be some sort of equilibrium around which dog populations fluctuate. So is there a community carrying capacity for owned dogs, and what are the factors that actually influence that?
It's already the time is. Then you have one. How much? It's already done.
Oh, sorry, I didn't see the yellow. I'm
Then,
colorblind.
a couple of seconds.
Couple of seconds to wind up. Yeah. Anyway, the point here is that we need to understand a little bit more about what regulates these factors and whether or not they are density dependent. And certainly disease, as we've seen in this one, is a major factor. But longer term studies are actually needed to do this. One final point, this is the last slide. I think we need to be careful of the possibility that interventions that focus solely on reducing birth rates could actually make own populations less stable, particularly in the face of these continuing high mortality rates. When the population is below that carrying capacity, we can predict that increased human-mediated in-migration of dogs will occur. And this will actually just perpetuate the turnover of those dogs and potentially create a system where we're actually moving parasites, we're moving diseases more than we might otherwise have been doing. So I think we need to be looking at cost-effective interventions that not only reduce birth rates, but mortality rates as well. And I'd just quickly like to acknowledge particularly the funders, the Morris Animal Foundation, as well as the International Fund for Animal Welfare for allowing me to be here, and then my centre at Ross University for also covering some travel costs. Thank you very much, and I apologise for going over time.
James Serple, University of Pennsylvania. Question for Darryn Knobel. You mentioned so many households saying they don't have enough dogs, that they want more dogs. Can you just maybe clarify why they want these dogs? What's their motivation for owning all of these dogs? Is he still here?
Sure.
He's here.
Sorry.
We didn't do it on a sort of house-by-house basis, although I am interested to kind of understand individual household level motivations a bit more, almost as a predictor of dog ownership either currently or in the future. But in very general terms, people want dogs for the I can't remember the name of the horizontal axis that you presented. But yeah, so the instrumental value of the dogs by and large, although I think there is a certain degree of affinity to dogs as well. But the factors mentioned are to guard the household, to guard property, as well as to a lesser extent to guard livestock. But those are the kind of the main reasons that were mentioned.
Thank you. We have, I think, the last question here.
Yes, thank you. Veronica from African Sales and the Cape Animal Welfare Forum from South Africa. Just an interesting point with your presentation that I find we work in the townships or the communities that haven't got access, and you saying the people that own the 4 or 5 dogs are saying they do want more. However, if you look at the welfare of those 4 or 5 dogs, the education level of those owners, and if the correct legal structures and laws were there, they most probably would not be allowed to own those animals. I think to say that someone with even 2 dogs, they want more, should they have more? I think that is a question that should be asked. And I think also with our experience, depending on areas in the country and also even areas within the Western Cape we work in, that dynamic is very, very different. So I think it's definitely something to consider to say, and I do agree, I'm here with Dr. Roos from CBC, that we don't have a situation where we have overpopulation yet. However, the ownership of those animals in more than one, and some of them should have none, I'm not sure that is a true reflection to say there can be more animals or it's not a problem because the people do want more animals.
Yeah, thanks for the comment. I think this is a survey that it's a question that we've just added to the ongoing data collection, and I'm curious to see how those patterns kind of change over the time and whether or not they actually provide a quantitative prediction of that carrying capacity. And I think we need to look at them in a little bit more detail and not just interpret them superficially. I think there's a difference between wanting more dogs, which is probably how we ask the question, versus being able to have more dogs. So we may need to sort of refine how we ask that question. I think also, at least with this relatively small survey as a proportion of the total number of households, we did about half of the households, or at least that's what I presented the data on. I don't know how many of those dogs that have sort of 3, 4 or more actually have bitches with litters of puppies at the time. So again, it may be a relatively sort of transient thing. So I'm cautious not to kind of over-interpret the large numbers of dogs. I'm kind of at this stage more interested in the fact that a lot of non-dog owning households and households with maybe only 1 dog seem to be in a position to absorb excess dogs. And certainly what we saw with the way dogs move from households, very few dogs are bought or sold. They're actually given away as gifts, and I presume those households then absorb them. So it'll be interesting to see how that kind of fluctuates over time as the population as a whole sort of fluctuates.
Perfect. Thank you very much. I think